Today, I am going to talk about the REN Mai, or the conception vessel. I'm going to call it the REN Mai because it's not really just about conception. It does a lot more than this, right? So I'm going to keep it the pinyin or the Chinese name and call it the REN acupuncture points. We're going to look at all 24 of them, their function, location, and my clinical pearls since I've been practicing since 2003. I love the REN vessel in clinical practice because it's so effective. Are you ready? Let's do this. Welcome back to my channel. If it's your first time here, I'm Clara from AcuPro Academy, and I create Chinese medicine and acupuncture content for students and practitioners, making it easy to grasp and fun to learn. Okay, so as I said when we first started, the REN Mai or the REN vessel is also called the CV or the conception vessel. Like all the 8 extraordinary vessels, it circulates essence and connects to the TCM kidneys. It is called the C of all yin channel. It is in the front, right in the middle line, so it really connects with all the yin channel. It influences the abdominal region, the chest, the throat, the lung, and the face. And because, of course, it's called the conception vessel, it regulates the uterus for menstruation, fertility, pregnancy, menopause, and everything related to the female reproductive system. It also moves qi in the lower jiao for fibroids, hernia, and urinary issues, the middle jiao for digestive issues, so it really connects to the spleen and stomach, and the upper jiao for asthma and chest pain, which we'll see a lot of the points do help with anything that's happening in the cardiovascular system, anxiety, or breathing difficulty. And finally, it calms the mind. The REN Mai calms the mind specifically for anxiety, but it's also the vessel that is in charge of self-care and self-love. The REN allows us to find balance and feel secure and safe. Because it is a yin meridian, it is more feminine in nature, so it's in charge of being compassionate, nurturing, and caring. It is literally our softer side. Now, if you want an in-depth look at all the 8 extraordinary vessels, I'll have the link to my video below and also to the podcast, which touch on psycho-emotional pain using the 8 extra vessels with my guest, the one and only wonderful Dr. Yvonne Farrell, my TCM rock star. I absolutely love that she came on the podcast. Dr. Farrell has taught me everything I know about the 8 extra vessels, and that podcast interview was so much fun for me. I learned, again, so much more, and she made me cry. So if you haven't listened to it yet, the link is also below for you. One of the characteristics of the 8 extra vessels is each of them has a confluent point that connects them to the 12 main meridian. The REN vessel confluent point is long 7, and its paired point is kidney 6, which is the confluent point of the yin chao vessel. Together, long 7 and kidney 6 combined work really well to balance the reproductive system, specifically the female reproductive system. So for anything happening when there is irregular menstruation or painful menstruation, fertility issue, menopause, pregnancy, it is a perfect pair. But it also opens the chest for allowing better breathing, for relieving the throat, and opening the voice for our ability to be able to voice our thoughts as well. So that combo I love to use in clinical practice. The REN and the DO together make kind of like a wheel with the body that's continuously flowing, meaning that one is in the front, the REN, and one is in the back, the DO. And together, it does this little loop this way in both ways. So they're connecting specifically because both of them start at the lower jiao and connect to the kidney and the Mingmen fire. So really connected to essence. And of course, the REN and the DO are the only 8 extra vessels that have their own points. Before we start, I have a story I want to share with you. Imagine this. It's the first day we are actually going to needle patients in school at the clinic of the school in TCM College. I'm so excited. The patient that comes in has issue with breathing and asthma. And my teacher says, Clara, you are needling first today. And I was so nervous, but so excited. We get into the room and she's like, we're going to do REN 22. And you're going to start with that point. Oh my gosh, REN 22, which she explained we have to go and bend the needle so we can go behind the sternum. And I was looking at my teacher and I was like, no, I'm not doing REN 22. And she's like, yes, you are. And I said, no, I'm not. And she said, yes, you are. I said, it's my first point needling someone that is not a student in class. And she said, you are going to do this point. And the patient looked at me and said, oh, I've had this point before. It's okay. Go for it. And I thought, well, if the teacher and the patients are okay, I guess I got to do it. I was so nervous. I did it. I went behind the sternum. I needled REN 22 and everything after that was so easy. I had to needle spleen 6 and lung 7 and kidney 6. Easy, no problem. In a way, starting with the hardest point for me in my mind was such a good teaching moment. So I thank my teacher for pushing me with that one because everything else felt like a dream. Okay, you ready? Let's look at the REN points. REN 1 is not an easy point because of its location. It is located between the anus and the scrotum in male and the anus and the labia in female. Have you ever needled REN 1? I haven't. I'm a believer that any points that I haven't received on me, I don't want to do on somebody else because I want to know what it feels like. And I've never had REN 1 done on me, so I've never done it on anybody. I want to be completely honest with you. The patient has to be really, really comfortable with you doing this as well. It's a very sensitive area, so I get that it's not easy. However, I have a friend of mine who treats a lot of erectile dysfunction and has done REN 1 on quite a few male using electrostimulation in order to get some blood flow in the area and to help the person with erectile dysfunction. So it is a really good point. It's just not very comfortable to needle for a lot of reasons, as you understand, right? So the function of REN 1. It's great for everything or anything in the lower jaw, irregular menstruation, vaginal issue, urinary incontinence, hemorrhoids. However, DO1 is a better point for hemorrhoids, so I won't even bother with that. And erectile dysfunction or seminal emission when it comes to men, like I said earlier. Now, REN 1 is a ghost point. I love ghost points. And if you haven't seen my videos with all the ghost points function and how we use them in clinical practice, I'll add the link below for you. This specific ghost point is really good for women that have sexual anxiety and that have difficulty in reaching orgasm, specifically after childbirth. It's such a great point. It nourishes yin, nourishes essence, clears damp heat in the lower jaw, and regulates the chong and the REN vessel for irregular menstruation. Fantastic point, however, not easy to use. Now let's look at REN 2. The points on the REN meridian are easy because they're all located in the midline. Very simple. Now remember that from the belly button to the upper border of the pubic symphysis is 5 tsun. All the points are going to go up from there. So REN 2 is located 5 tsun below the navel on the upper border of the pubic symphysis bone, of course in the midline. Like the previous one, it does clear damp heat in the lower jaw for excessive vaginal discharge that is abnormal, urination issues like murky, dark, painful urination. It warms and tonifies kidney yang, we can use moxa, specifically for low libido, impotence for male, and seminal emission. We don't have a lot of points for men. This is a good one with kidney 10 as well. Those 2 points, really good for that. And it's easier, obviously, to needle, to reach than going in the area of REN 1. REN 2 also regulate menses for irregular menstruation or dysmenorrhea. REN 3 is located 4 tsun below the belly button at the midline, of course, like all of them, and it is the front mu point of the bladder because of its location, of course, which makes sense. So it benefits the bladder for urine retention, incontinence, or frequent urination. Like the previous one, it also warm and tonify kidney yang and kidney essence for impotence, low libido, and seminal emission for men. But REN 2 is better than REN 3 for that perspective. It regulates the menstruation for dysmenorrhea and irregular menstruation as well. And it clears lower jiao damp heat for vaginal itchiness or external genitalia itchiness and outbreak. However, I think liver 5 is a better point for that. And of course, it can be used for lower abdominal pain due to lower jiao issues. REN 4, what a fantastic point, located 3 tsuen below the belly button in the midline as well. And it is a front move point of the small intestine. Now, one of the most powerful function of REN 4 is that it warms the Mingmen, and it warms kidney yang, and it warms the whole lower jiao area. So we can use moxa on this point specifically for diarrhea, rectum prolapse, enuresis, frequent urination, erectile dysfunction or impotence, low libido, fertility issues, and seminal emission. Really good to warm up the Mingmen fire. That's what we use it the most for. However, because it's the front move point of the small intestine, it does help in separating the clear from the turbid, specifically when there is issue with urination and dark, murky urine. But one of the things that it does is that it safeguards and prevent disease. It's kind of like stomach 36. REN 4 and stomach 36 are here as a preventative measure. It's great to use them constantly in your treatment for preventative health, which is the best way to help our patients because prevention is better than having to treat people when they're deep into a problem or an issue, right? Makes sense. It also, of course, warmed the uterus in conjunction with stomach 29 for painful menstruation, postpartum or post-childbirth to help when there is a lot of yang deficiency. And it can be part of a protocol for prolapse, but if the prolapse is due to spleen qi sinking, REN 6 is the better point because it lifts the qi with spleen 6 and do 20. However, you can add up REN 4 if the person is also yang deficient and do moxa. Perfect for that. Now, I don't know if I've ever shared, but I've had patients with uterus prolapse, stage 1, stage 2, and acupuncture has brought it back up. It's fantastic. If my patients can come a few times a week, it really helps very quickly. But we have to do the treatments very close together for that purpose of prolapse. REN 5 is 2 tsuen below the belly button at the midline again, and it is also another front move point, the front move of the sanjiao, or the triple warmer, triple burner, triple energizer, all the names you can have. I'm going to keep it the sanjiao. As you know, I'd rather do that. It regulates the uterus for scanty menstruation, amenorrhea, and postpartum issues. And it clears excess damp. All the other one below were clearing damp heat. This one just clears excess damp for excess vaginal discharge, edema, diarrhea, and bloating. If you combine it with REN 9, that is fantastic for any of those issues, right? Because the sanjiao is in charge of clearing dampness, as we know, but REN 9 is also a clearing damp point. So REN 9, REN 5, and spleen 9, perfect combo to get rid of swelling or any excess dampness, specifically in the middle and lower jiao. REN 6 is 1.5 tsuen below the navel. So it's a little bit different because each of them were 1 tsuen below, but this one is 1.5 tsuen below the navel. What's interesting about REN 6 is that it's called the Sea of Qi. Qi, high in Chinese, which makes it perfect to tonify qi. So if there is qi deficiency, long qi, spleen qi, kidney qi, heart qi, any kind of qi deficiency, we always want to do REN 6 and stomach 36. Those two together are going to be a great combination to tonify qi. Now, if the qi is sinking, like I said earlier, then we can use REN 6, spleen 6, do 20 to lift, and then stomach 36 to tonify. Perfect. This is how easy we can make treatment plans. If we can't always figure out a diagnosis or which organ is affected, always use REN 6 no matter what with stomach 36. Those are your basic points. It regulates the uterus for postpartum hemorrhage, heavy menstruation, or irregular menstruation with a lot of bleeding on and off. And like the previous point, it also clears dampness for bloating and edema and diarrhea, but REN 5 being the front move point of the Sanjiao is a better bet. Really use REN 6 as a qi tonifying point. That's what it's best for. I think we forget about REN 7 in clinical practice. Do you use it a lot? Let me know. REN 7 is located in the anterior midline like the other one, but one soon below the navel. It also, like REN 6, regulates the uterus for hemorrhage postpartum or heavy menstruation or irregular menstruation. And it clears dampness for bloating, diarrhea, or excess vaginal discharge. However, I think this point is best used for pain around the navel. And that usually comes from the small intestine, the physical small intestine. So that's a really good point for that. You can palpate and decide, ooh, there's a lot of pain there, so I should needle REN 7. REN 8, here we go. The only point in the body except for stomach 17 that we do not needle because it's located in the navel. Like stomach 17, which is located at the nipple, REN 8 being in the navel, those 2 points we never needle. But what we do with REN 8 is we moxa because it is the connection to our uterus, ligament, essence, and everything that has to do with the reproductive system and our connection to our mother through the umbilical cord. So this is a really good point to moxa. We can moxa using salt, ginger, or just do moxa sticks. Having heat in REN 8 is fantastic because it warms and restores yang for fainting or rectum prolapse. Now, if there's rectum prolapse, we want to also do spleen 6, REN 6, and we probably want to do one as well as RBI, and we want to do 20. So there's a lot of points when it comes to rectum prolapse for the pain as well, and the issue, obviously, it depends the stage of the prolapse. REN 8 also helps regulate the intestine for bowel issue, abdominal pain, and diarrhea, specifically due to kidney yang deficiency. Kidney yang deficiency diarrhea is diarrhea that has a lot of undigested food in the stool. So we really want to moxa when that happens. Now, what's interesting is a lot of my students ask, what happened when you pierce your belly button? Does that affect REN 8? I don't think there's any study on this. We don't know for sure. My teacher said that you're stimulating a point constantly is probably not the best. And what's interesting is I have seen patients that have come to me with a belly button piercing and they all have issue with the reproductive system. All of them. It was irregular menstruation, painful menstruation, or fertility issue. So I don't know if that's just coincidence, but for me, I kind of believe my teacher that overstimulating a point, probably not the best, but who knows, right? Before we continue, I wanted to make sure that you know that all the graphics you're seeing today are from my book, Acupuncture Made Easy. This is my most popular book and it had sold all over the world because it ships everywhere. But if you'd rather have the digital version, it comes with a lot of video links to complement it. So either way, you can't lose. This has been such a great tool for students, but also for practitioners. If you don't have a copy yet, the link is below for you. Check it out. REN 9 is one soon directly above the belly button. REN 9 is the best REN point for eliminating dampness. So it's great for bloating, diarrhea, edema, urine retention, abdominal pain due to excess water or excess fluid. Now, if you combine it with spleen 9, it's fantastic to get rid of excess water. And then you can also add up gallbladder 34 and REN 6. Now, let's talk about the Digestive Diamond. I love this and it works so well in clinical practice. 4 needles, 3 points. REN 6, REN 9, and stomach 25. All points around the belly button. They form a little diamond shape, right? So this is the digestive diamond. If you're not sure what your diagnosis is for your patient, sometimes it's really difficult, right? We want to make a diagnosis, but it might take a little bit of time. But your patient has issues with their digestive system, constipation, diarrhea, irritable bowel syndrome, diverticulitis, colitis, anything happening in the digestive system, lower digestive system, not the stomach, so I'm talking about the lower digestive tract, you want to do the digestive diamond. Now, if there is constipation, you want a needle from REN 6 up stomach 25, REN 9, and down stomach 25, like in the same way that the colon is going. Ascending colon, transverse, and descending. Because you're trying to push and make everything flow. For diarrhea, you want to do the opposite. You still can start at REN 6, but now you're going to go on stomach 25, that's on the side of the descending colon, because you're trying to go opposite of the way the colon is going. Then REN 9, and then you finish off with the ascending colon. Does that make sense? So that's how we use the digestive diamond. It is so powerful in clinical practice. My patient loved that diamond, and I've been surprised at its effectiveness every single time. REN 10 is tutsun above the belly button. Now we're going up along the midline, right? And REN 10 is great to promote better digestion for indigestion, bloating, abdominal pain, vomiting, stomach pain, and borborygmi. You know, borborygmi is like that, like when people say, hey, your stomach is speaking, that's borborygmi. REN 11 is tsun above the belly button at the midline, and it is the only point that is very good for people that have lost their appetite. So if you have patients that say, I can't eat, I don't know, I'm never hungry, maybe it's due to emotion, anxiety, whatever, stress, but they can't eat, they need to eat, especially if, they're losing body weight, that is not good. Or if they're anemic, right, they do need to eat, or if they have low blood pressure or low blood sugar. So this point is really great to stimulate appetite. It harmonizes the spleen and the stomach, specifically for the indigestion, vomiting, bloating, stomach pain, and again, borborygmi. REN 12 is tsun above the belly button, and it is the front moo point of the stomach. We use it in clinical practice all the time because it's so powerful. It is perfectly located, and it's so great for stomach issue. It harmonizes the stomach and brings stomach chi down, specifically for acid reflux, vomiting, nausea, acid regurgitation, indigestion, and stomach pain. Doesn't matter if it's acute or chronic, we gotta use REN 12. Now, if there's a lot of acidity or stomach chi rebelling, we also want to add REN 17 and pericardium 6. That's a great combo. REN 13 is tsun above the belly button, and it's very similar in its function. It's great to bring stomach chi down for all the stomach chi rebelling, like the previous point, or nausea and vomiting. But what makes it different is that it calms the mind when there is insomnia due to overeating. Now that's a great point. Specifically, if there's a lot of overeating at night that creates insomnia, we can do this point, REN 13, plus we can do stomach 36. That is a great combo to kind of bring that down. And then we can calm the mind with heart 7, pericardium 6, another point to calm the mind. But if it is due to overeating, we want to educate the patient. That's why they're not sleeping well. Makes sense, right? REN 14 is tsun above the belly button, and it is the front moo point of the heart. See how many front moo point the REN vessel has? That's why it's so powerful, and that's why it's not just about conception, right? I compare it a little bit like the back shoe point of the bladder, right? Not that all the front moo point are on the REN vessel, but a lot of them are. So because of such, it opened the chest for palpitation and anxiety. However, I would say that REN 17 is probably the better point for that, but you could combine REN 14 with REN 17 together when there is a lot of anxiety, plus pericardium 6 and stomach 40. Great combo for anxiety. It calms the mind for insomnia because, of course, it's the front moo point of the heart, and it can be used for manic depressive patients. And yes, it harmonizes the stomach for stomach chi rebelling, but that's not the best point. So I will really focus on more the heart and the mind and the shen and the spirit with this point. REN 15 is tsun directly above the belly button in the midline, just below the xiphoid process. It is the lower connecting point from the REN to the DO. This is why it should be used as part of a protocol for epilepsy. When there is epilepsy, both meridians are affected, the REN and the DO specifically, and it is coming from kidney essence. So this is a really good point to have as a part of a protocol. We also have DO9 or other points in the back from the DO meridian that can also be used to prevent attacks of epilepsy. You want to do a TCM diagnosis because it's not an easy disease. But remember, when there's epileptic attack, there's internal wind because all that movement is internal wind. So we want to address the internal wind. Because of its location, it also opens the chest, relaxes the chest. For cough, acid reflux, chest pain, anything happening around the esophagus and chest area. But I will say that's probably not the best point for that. Really use it more for being part of a protocol for seizure. REN 16 is located at the 5th intercostal space at the anterior midline. I don't think I use REN 16 that often because I think REN 17 is one that I use all the time. So I don't think I've used it many times. It really opens the chest, relaxes the chest, and brings stomach chi down, but not the best point. Let's talk about REN 17. So much better. Okay. REN 17 located at the midline at the 4th intercostal space. This point, I always needle going downward, never upward, always downward along the sternum. It is the front move point, here's another one, it is the front move point of the pericardium. And as such, it really protects the heart, so it's really, really good for opening the chest when there is anxiety, palpitation. That is really going to work well with pericardium 6 together. My favorite combo when there's anxiety and we're not sure about the diagnosis is REN 17, pericardium 6, and stomach 40. That to me works like a charm. Now you can add up the Buddha's triangle, which is pericardium 6, heart 7, and lung 9 if you wanted to. But those 3 points, if you just want to do 3, because I've had kids as patients and I don't want to overwhelm them, and kids react really well when you have a least amount of needle. So REN 17, stomach 40 on both sides, pericardium 6 on both sides, that's only 5 needles. It's perfect. It's the influential point of qi. As such, it brings qi down, or rebelling qi down, as lung qi or stomach qi rebelling. So for cough, acid reflux, this is a great point. I love to use this for nausea during pregnancy with kidney 27, pericardium 6, and stomach 40. Perfect for nausea during pregnancy. Let me tell you again. Nausea during pregnancy, kidney 27, REN 17, pericardium 6, and stomach 40. Beautiful. Yes, stomach 36 as well. Of course. REN 17, because of its location, promotes lactation when there is breast milk issue or mastitis in new mothers. I have put REN 18, 19, 20, and 21 together because they all do the same thing. REN 18 is on the 3rd intercostal space, REN 19 on the 2nd, REN 20 on the 1st, and REN 21 is one soon below REN 22 on the sternum. Still, they're all in the anterior midline. Now, all 4 points relax the chest and bring qi down for cough, chronic or acute, asthma, or chest pain. And here we are, what I talked about earlier, my needling REN 22. It is in the suprasternal fossa, and yes, we bend the needle and we go behind the sternum to needle this point. REN 22 I have used in practice many times because it works really well for asthma. Specifically when there's a lot of phlegm, right? The patient's really asthmatic with a lot of phlegm. This works really well. It's also really good for people that have lost their voice, maybe after a concert or after talking a lot, or for people that have difficulty in voicing their truth. Remember, the REN vessel is in charge of self-care and our connection with others and compassion. And sometimes people bury all this down and don't voice or say what they need to say because they are caring for a lot of people. But they give, and they don't know how to say no. This is a really good point to open the chest, open the voice, and allow ourselves to be who we truly are and tell our truth. Pretty cool, no? REN 23 is above the Adam's apple on the upper border of the hyoid bone. I think I've needled that point once. That's it. And the reason I needled it was because I had a patient post-stroke to really help to get speech back and movement back, specifically in the tongue and mouth area, combined with REN 24 and a lot of other points on the face as well. This really loosens the tongue for aphasia, post-stroke, like I said, stiff tongue, or tongue paralysis. Yes, it can be used for sore throat or hoarse voice, but it's not the best point for that, and it's not very comfortable neither to lay with a needle in here unless you don't feel it because you had a stroke. So that's more why I use it. Last but not least, REN 24, located in the mental labial groove. So many people have a little dimple there, right? It is a ghost point. Don't you think that's interesting that the first point of the REN vessel is a ghost point and the last point is also a ghost point? So cool, putting it all together. Now, what does it do as a ghost point? This is used for people that are consumed with dark thoughts for years and years and years and have lost their ability to laugh or even smile. Because of its location, it's supposed to open your lips, relax the lips to have the ability to smile. So it's really cool and it works really well. I have used it for patients before. And if we do it on a regular basis with other point and do a diagnosis, because of course there's a lot of depression and there's a lot of issues there, it works really well in having patients starting to smirk and smile, which is so important for their soul, right? Now, it's also very useful for post-stroke or for Bell's palsy. I've used it a lot in my protocol for Bell's palsy to get the facial muscle activated again. Wow, I can't believe we did all the 24 acupuncture points of the REN Mai. Those are fantastic points. My favorite are definitely REN 17, REN 12, REN 4, and REN 6. Which one is yours? Let me know in the comments below. I hope this was useful and a great revision. Check this video out. No matter what, keep rocking it using TCM, and I'll see you in the next video.